Our team is interested in tissue adhesive in ocular surgery. Tissue adhesive is commonly used as an adjuvant to surgical wound closure in ophthalmology. Phototherapy-assisted wound reconstruction with tissue adhesive is becoming a new choice of treating modality in the modern era. Corneal lacerations presenting as a result of infection, inflammation, or trauma are ophthalmic emergencies that urgently require appropriate intervention. Suturing is a time-consuming task in ophthalmology, and suture-induced irritation and redness are frequent problems. Therefore, ophthalmic surgeons are switching to sutureless surgery. Corneal gluing with cyanoacrylate and fibrin-based sealant have traditionally been the most widely used glues for ophthalmic surgery. Briefly, cyanoacrylates are a type of synthetic glues that polymerize via an anion. The toxicity and degradation rate of the cyanoacrylates glue depend on the length of its alkyl side chains. The mechanical strength is also related to the number of this side chain. Fibrin glue is another alternative and used in place of cyanoacrylate tissues adhesives in many conditions, with the advantage of reducing the conjunctival and corneal inflammation to a large extent. It is a biological adhesive including fibrinogen component and a thrombin content, which imitates the final stage of coagulation cascade. Although the tissue adhesives, cyanoacrylate and fibrin glue are widely used in small corneal perforations, they are not stable and cannot be sustained in the defect site as a filling material. Herein, we proposed a novel therapeutic modality using phototherapy-assisted polymerization of hydrogel-based tissue adhesive in order to overcome the drawbacks and risks associated with the existing treatments in clinical practice. The common understanding of photo-induced cross-linking is the exposure of photosensitizer to proper light source in order to form excited state and generate singlet oxygen in initiating the subsequent photochemical reactions. In this procedure, blue light-induced cross-linking with the riboflavin, which exhibits photosensitizing properties, occurs in two different mechanisms. Pathway A is the reaction that mediates the formation of lysine on the peptide chains of collagens. Pathway B is where the imidazole intermediate to form the histidine-histidine cross-linking. Therefore, we used urocanic acid, which possesses a carboxylic group reacting with an amino group on chitosan to synthesize urocanic acid chitosan in order to induce the photocross-linking reactions. The reaction of cross-linking the biomaterials to the tissue is of importance in order to seal the wound and prevent the leaking. In the tissue around wound edge, the lysine on the peptide chain of collagens induced by singlet oxygen reacts with the imidazole ring of urocanic acid chitosan to form the new amide bonds. On the other hand, the cross-linking within UAC itself undergoes the formation of histidine-histidine cross-linking reaction. In summary, both photochemical reactions are expected to enhance the mechanical strength of the tissue adhesive with slower degradation rate as well as lower toxicity. This tissue adhesive is considered to have enough working time before it solidifies, have adequate tensile strength, be permeable to fluids and metabolites to prevent necrosis, have minimum induced inflammation, be biocompatible, easily accessible and affordable. This phototherapy-assisted hydrogel-based tissue adhesive promises to become a prompt and effective treatment that aids in the management of small corneal laceration, melts, and wound leaks, and gives improved visual outcomes and reduced enucleation rates and the need of keratoplasty in many situations.